My roles and area of responsibility are to be a teacher, a researcher, and to do service for the school, the university, and the discipline of nursing. I've been a nurse for almost 30 years now, so it's been quite a while. All of those have been spent in critical care. I got my Ph.D. in 2003, so relatively later, and I became interested in health services policy and health services research early on when I realized that the healthcare system wasn't necessarily configured in the best way for me to deliver care to patients. So that started my journey on examining how the work environment and different factors in the work environment affect how I can deliver care as a nurse. My specific area of research is I investigate how communication between physician and nurses affects outcomes for hospitalized patients. In nursing, I learned things in one disciplinary perspective, one kind of body of knowledge, if you will, and physicians learned another. And there was just this siloed approach to how we are trained. And unfortunately, that then has implications for how we understand each other because we don't speak the same language. So that's kind of how I became interested in it. What we're doing in a currently funded study that I have will look at the way physicians and nurses use EHR, pagers, phones, iPads, all of this current technology that we have, and we'll look and see how that information then gets transmitted between the physician and nurse, and is there a way maybe that software can be developed, or can we find some other way so that in the future that message and that medium are better aligned. When we all get together, physicians, nurses, pharmacists, nutritionists, all of the different healthcare disciplines, when everybody gets together, the patient's outcomes can be much improved. When I think about what is the most pressing healthcare issue, I think what it is that our healthcare systems are built for efficiency and standardization, whereas on our end as healthcare providers, we have different patterns of workflow. So I think there's this big tension then between what the healthcare system is asking us to do and how they're asking us to standardize our practices, and then how we can actually deliver care and work as a group to make sure that all of these nuances and all of these unpredictable things in healthcare are met. I would describe IHPI as a petri dish that has that substrate in it that provides nutrients and allows growth and collaboration. When the U of M made that decision to form IHPI, put money into the project, gave a physical space as well as internet space, emotional space, any kind of space you can think of really, I think that was a huge plus and a huge gift. So it's not just that we talk interdisciplinarity, but we also actually put something in place to implement it and to make it happen. The future of healthcare is very murky in my opinion. I'm not quite sure how it's all going to play out. However, what I do believe is that IHPI is perfectly positioned to maybe help that, so that when we do start to unravel some of these threads, and when we do start to get answers to some of these questions about what is the future of healthcare looking like, IHPI is there and can help us to perhaps spread the word and get the information out there. That's how I see it right now, but I really don't know.